Welcome to the first module Introduction to Medical Coding from Chapter 1 of Unit 1. This course has been designed to be a review course to help prepare you to take the CRC, the Certified Risk Coder Certification exam from the OPC. Hello everyone. My name is Emily Taylor. I am the Chief Medical Coding Instructor. Welcome to our module series on Certified Risk Adjustment. Throughout this module series along with my colleague Michael, will guide you in your quest to become a Certified Risk Adjustment Coder. From teaching you how to read the ICD code book, to detailing all the conditions that are frequently coded, this module series will encompass every detail related to medical coding. After the completion of this series, you will get a firm knowledge of how things work in the U.S. healthcare industry. Not only you will be able to accurately document a patient's history, but also help providers document a diagnosis correctly, helping them save lives. Let's get started on this journey. In this module, we will describe coding as a profession and define the role of a risk adjustment coder. Medical coding is a system of using unique combination of numbers and alphabets for each diagnosis, test, treatment consequence, surgical process, symptom, birth and cause of death in human beings. Additionally, these codes serve as standard communication of supplies and procedures used in the treatment of human conditions. Medical coding is the key component in acquiring insurance refund and maintaining patient records. Accurate medical coding is important for billing as well as monitoring information regarding disease and its treatment procedure. Coding claims allow the insurance payer to identify the illness of a patient and the method of treatment.
What are the different codes involved in medical coding?
Other than the ICD codes, medical coding involves CPT, DRG and HCPCS codes as well.
Is it that coding is done only by a coder?
Mostly. But a physician too may perform coding. So, when a physician performs the coding, as a coder you audit and verify that the documentation supports the code selected by the physician. Generally, a coder receives the documentation and codes the services based on details in the medical record.
What if the medical record is inaccurate or incomplete?
In that case, it will be difficult to convert the findings into codes. Therefore, a coder must always make it a practice to evaluate the medical record for completeness and accuracy, and communicate regularly with physicians and other healthcare professionals to clarify diagnoses or to obtain additional patient information. Coding can take place in an inpatient and outpatient setting. Hospital inpatient coding focuses on a different subset of skills, where coders work with ICD-10-CM and ICD-10 pieces. These coders also will assign medical severity diagnosis-related groups. Outpatient coding focuses on physician professional services and outpatient facility coding. Outpatient coders will focus on CPT, HCPCS Level 2, and ICD-10-CM codes. They will work in physician offices, outpatient clinics, and facility outpatient departments. Outpatient facility coders will also work with ambulatory payment classifications.
So, it can be said that it's the documentation which governs proper code assignment.
Not only the documentation, but also the rules that govern each code set in a given instance. Coding rules are subject to whether the patient pays for own treatment, or compensated by a health insurance firm. Features of risk adjustment coding. Before we define the role of a risk adjustment coder, let's look at the features of risk adjustment coding. The ICD-10-CM code set is used to code diagnosis in risk adjustment coding. Claims data and medical record documentation serve as the source for risk adjustment diagnoses. Risk adjustment coders may work for health plans or provider, or may work in other healthcare entities. Regardless of the setting, code updates and insurance payment policies may change as often as quarterly. Coders require continuing education to stay well informed of these changes. Role of a risk adjustment coder. Risk adjustment coders mainly function in a health plan or for a vendor who is working with a health plan. They also work in provider offices when the providers have risk-based contracts. Payment to the Medicare Advantage organization depends on the diagnoses reported by a provider. Since proper documentation and coding is related to correct reimbursement, risk adjustment coders must know the complexity of diseases associated with chronic conditions, and ensure that the documentation supports correct health status of the patient. Apart from this, risk adjustment coders will be responsible for educating providers on proper documentation and coding. Additionally, a coder may be responsible for following up on denied claims by auditing the patient's chart, refiling and appealing claim, and taking necessary steps to confirm the correctness of claim. Most importantly, keep in mind to code all documented diagnoses, regardless of it being risk-adjusted code or not.
What kind of opportunities we can look forward to in educating providers?
You might come across a case where the patient is on insulin, but the provider has missed documenting diabetes. This will be possible when you have a comprehensive knowledge of medications, treatments, and diagnostic tests.
Other than communication and financial purpose, how else is coding important?
Diagnosis codes are also used to study disease patterns in the world for information on health and death. The member countries of World Health Organization use the resources to tackle widespread health issues, educate the general public on prevention and treatment, and ensure the future health and well-being of its citizens. Click here to know more about the profession of medical coding. This brings us to the end of Module 1 from Chapter 1 of Unit 1. In this module, we described coding as a profession and defined the role of a risk adjustment coder. You can go through this module again whenever you need more clarity.